According to the American Heart Association, or AHA, there are more than 356,000 out-of-hospital cardiac arrests annually in the U.S., and nearly 90% of them are fatal. A medical emergency can happen anywhere and at any time, so it's important for us to, as a society, be able to react to these situations as quickly and accurately as we can. When I last spoke about basic life support training, I gave you a short summary of what it entails. Today, I want to dive deeper into the topic by introducing a concept that allows the basic life support process to be quick and efficient: the chain of survival. Hi everyone, I'm Maria from eTactics, and today I'm going to talk about the chain of survival and how it fits into basic life support training. Before we get started, make sure that you subscribe to our YouTube channel by clicking the button below. Also hit that alert bell icon so that when we post new, helpful content, you get notified. While I hope you never have to witness an emergency situation, the reality is that you will most likely come across one in your lifetime. That is why the AHA promotes the chain of survival as a way to quickly and effectively tackle medical emergencies. This concept includes 6 actions that may help increase a victim's likelihood of surviving a cardiac episode or another life-threatening emergency. A bystander should perform the following 3 of the 6 steps of the chain of survival as soon as possible. Number 1, recognize the possibility of cardiac arrest in the victim and call 911 immediately. After having called the emergency services, begin the BLS process. If there is another bystander, ask them to find a nearby AED. 2, begin performing CPR. Start with chest compressions at a rate of 100 to 120 compressions per minute and push at a depth of 2 to 2.4 inches. If it helps, space out the compression to the beat of Stayin' Alive by the Bee Gees. Ironic, I know. 3, if possible, provide rapid defibrillation. When using the AED, attach the pads to the victim's bare chest, turn the device on, and follow the prompts given with the machine. If the AED does not bring the patient back to consciousness, revert back to CPR again. Hopefully at this point, emergency services will arrive. A medical professional will perform these final 3 steps of the chain, which are: number 4, initiate advanced life support or advanced resuscitation; number 5, post-cardiac arrest care by hospital professionals; and number 6, recovery, which includes long-term support, treatment, observation, rehabilitation, and psychological support. Depending on where you live, the time from the EMS call to the EMS arrival may vary. In some communities, the time between the call and arrival is 7 to 8 minutes or longer, so the first minutes after a victim collapses are the most critical. Administering the proper care early on has a direct effect on their chance at survival. I know this is all kind of bleak, but here's some good news for you. According to the AHA, nearly 45% of out-of-hospital cardiac arrest victims survived after receiving bystander CPR. So while avoiding a medical emergency might not be possible in some cases, knowing how to handle them can give you a sense of control. Training doesn't have to take up all of your free time. You can work on it from the comfort of your home and when you have time. Consider taking an online training course on basic life support techniques so you can become the bridge between a victim and the professionals. If you'd like to learn more about basic life support training, reach out to eTactics, and you already made it this far into the video, so you might as well like it, share it, and comment below.